Good morning, Team Redstone. It's Colonel Smith, Colonel Medor, and Sergeant Major Jimenez. Brought to you by Redstone Arsenal. We will be doing our weekly town hall, virtual town hall. So far, our town halls seem to have been informative for you. And I will tell you, for the group of us here, they've certainly been informative. We understand what you're thinking about. And I think today we've got a couple topics that we're going to talk about, minus your questions, that I think you're going to be interested in. I'll say this, is that we did not have any preempted questions this week. So crossing my fingers, I believe that that's a positive note. It means so far we've done a fairly good job of answering your questions. And certainly our PAO offices have done their best to continue to answer them. As usual, I'll look forward to you typing in questions as they come up, and we will do our best to answer them. This morning, I'm going to start off and turn it over to Sergeant Major for our first conversation starter.
Good morning, Team Redstone. Sergeant Major Jimenez here, and again, thank you for tuning in to our virtual town hall, and thank you for those that have shared it as well to your links. As we push out the information to try to keep everybody informed of what we got going on. And I just want to start off with, it's really been about the readiness. It's really been about the mission and safeguarding our personnel here on the installation and in our community as well. I want to talk a little bit about the health protection measures that we took when we kicked off combating COVID-19. Some of the things that we did to help our personnel and our garrison here was reduced to mission essential personnel. We went to teleworking. We reduced gates to protect our guards. We went to drive-thrus in our restaurant areas on our installation. We trained soldiers to augment if we needed it. And we went to cloth face coverings at the PX and commissary and on the installation if you cannot maintain 6 feet. So some of the things that we did to ensure that we can continue to combat this COVID-19. What I ask of you, and I tell the community, is thank you for what you've done. Thank you as the individual for what you've done and in tremendously helping us combat COVID-19. And again, we come to you to help us even further as we look at a tailored, condition-based or phased approach of returning to work. We want you to continue to be safe out there. Continue to wash your hands, maintain 6 feet of separation, disinfect areas that are frequently touched, stay at home, very important, stay at home if you're sick and call your provider, and continue to wear a face covering if you cannot maintain 6 feet within personnel. Together we will get through this. And as the Colonel talks about what the governor put out, safe at home order, I just want to say thank you for your tremendous help out there. Sir?
All right. Okay, so Sergeant Major alluded to two things. He alluded to the governor's safe at home guidance, and he alluded to the installation's conditions-based, methodical, and phased approach to recovery. And I gather that that is probably going to be the majority of the questions that you ask us today. But first, let's cover the safer at home order. So on Tuesday at 11 o'clock, most all of us, or most of you at home, probably tuned in to listen to Governor Ivey present the safer at home order. Important to notice in the safer at home order that it did not lift the social distancing precautions that have been largely put in place throughout the state and the cities. What it did was it relaxed some of them. For example, rather than only limiting retail stores to those that provide essentials for each and all of us, like grocery stores and the home hardware stores, those places where we could get things we absolutely needed, what it does is it opens up retail stores throughout the city and the surrounding counties. It does so in limiting the number of occupants. Very similar to what happened before, or what had happened before. It opens the beaches. And probably the largest effect that it causes here directly on the Arsenal is it makes elective medical procedures active again. And Colonel Medor is going to talk about how that'll affect Fox Army Health Center and how that'll affect you. What it didn't do is it still didn't relax our limitation on number of people that we should be around at any point in time. It still states that we should limit ourselves to less than 10 people at any given meeting. We should still maintain 6 feet of physical space between one another. We should still, when able or when we're in close proximity to others in a public setting, we should still be wearing a cloth face covering. We should still avoid athletic facilities like gyms. We should avoid places like nightclubs, bingo halls, bowling alleys, and theaters, and it keeps those closed. We should avoid the barbershops, nail salons, massage parlors, and tattoos, and those will all remain closed. What the governor has done is she's taken a measured approach to open up parts of our community back to us in order to allow us to expand slowly the number of people that we come in contact with. But she is continuing to encourage all of us to minimize our travel and minimize how often we come in contact with large numbers of other people in groups. And they've put controls in place for those businesses around the community to help them remind us of our civic responsibility and our personal responsibility to keep ourselves safe. So I will tell you that first and foremost, I reach out to you as the Garrison commander, and I know all the leaders here on the Arsenal do, is we reach out to you to ask you to continue to adhere to the safer at home guidelines that the governor's put out there, and realize that the only way that we can make this work is if each of us holds ourselves accountable to follow those guidelines and take care of our own personal space, our personal hygiene, like Sergeant Major talked about, maintaining our social distances, putting on our own PPE when we're going to come in contact with people, and then, of course, minimizing those opportunities for us to come in contact with other large groups of people. I'm counting on you. We are all counting on you to do that. Now, how does that affect Redstone Arsenal? That is the immediate concern for all of you who work here. Redstone Arsenal has been hard at work with your tenant commands. The governor announced her Safer at Home on Tuesday, and the tenant commands sat down that very day on Wednesday, and we reviewed our already pre-made phased approach to how we are going to potentially come back to work. I assure you that come back to work plan, or that phased methodology to come back to work, is conditions based. As you all know, we are already providing those critical mission requirements that Redstone Arsenal owes to our federal government, owes to our national defense strategy. We're doing that already, and we will continue to do that. What we are seeking to do is to open up over a period of time those additional missions that Redstone Arsenal performs that add to what we do for our nation, as well as add to or provide benefit to those of us who serve. But we're not going to, our intent is not to expand our mission capability and not to expand our services until we're quite certain that as we increase the number of people, we can also minimize the number of individuals who come in contact with the virus. And we have controls or processes in place to minimize any spike or any outbreak of the virus when it occurs. So therefore, we have built the plan. Your senior leaders have been given the plan, and your organizations are currently hard at work coming up with their individualized recovery plan. And I can tell you, based on the meeting we had Wednesday, with all of your senior leaders, it is our intent at the installation level, we will not begin this phased and methodical approach until no earlier than the 15th of May. That leaves us the remainder of this week to continue to monitor and observe how Huntsville and the surrounding communities begin to open up your community. It leaves us the following week to continue to tighten up our plans and better prepare ourselves to receive you. It leaves that week for your tenants to tighten up, your tenant commands to tighten up their plans and communicate those plans to you. And then it gives us an additional week to assess the local community and the capabilities before we, Colonel Meadow, myself, and the other senior leaders on the installation make our recommendation to General Daly and General Perna about how we are going to move, or about whether or not we should move forward. Now, you ask me what those conditions are. I have to tell you that those conditions aren't set in stone. Those conditions are, as an example, the local case rate in the community, the community's capacity to treat should someone become positive for COVID-19 again, the community and Redstone Arsenal's capacity to monitor, and our capacity to test. We will use those 4 metrics to inform our recommendations. In addition, we will use metrics such as what other precautions the state still has in place so that we can ensure we remain synchronized with the state and our local community. And we will use the case rate within Alabama, because as you know, it's not isolated to just those of you who work here on Redstone. We also have to ensure that as you go home at night, the virus isn't growing outside of the installation and we have the tendency to bring it on. So we are going to monitor all of those things before we make a recommendation of how to take our next step forward. We believe this is about a 4-step process to bring us closer to normal, but we acknowledge that this process may take a long time and it may take iterative steps in order to ensure that we get it right. I can assure you that your tenant commands still have in place the contact trace teams. So should someone become positive for COVID-19 in your workplace, we have the ability to identify that individual and all of those people that they have come in contact with, so that we can remove them from the workplace and test them. We still have the ability to come in and disinfect your workplace, so that we can ensure that that workplace is safe for you to continue to work in. And your tenant organizations, as well as the installation, are stockpiling the necessary PPE to be able to provide you should you have to work in close proximity to others. We are putting all those things in place today in order to prepare for your eventual return to work. I can tell you today that of the 7.8 million square feet of office spaces here on Redstone Arsenal, we have already disinfected 7.6 million square feet, and we expect to complete the last 200,000 square feet today. When you return, you should see a big yellow sign in your general work area that tells you what the last date that area was disinfected was. In addition, I'll tell you that our standard custodial cleaning has been modified so that we have limited the number of times we're vacuuming or cleaning windows in trade for ensuring that we're wiping down and disinfecting those common areas where everyone touches, the doorknobs, the cipher locks, the keypads, your desks. We are ensuring that we increase what we disinfect, and we're reducing the number of times we do some of the normal housekeeping. I'm sure that as our footprint grows, we'll have to increase our standard cleaning. But at the same time, you should know that your organization and the area you're working in will receive increased, enhanced touches for your protection. I tell you that we believe we are taking all precautions to be able to bring you back onto the arsenal, but we are doing so. We're doing so in a very measured and methodical way. There's not a checklist program to do it. We are going to evaluate the environment and the conditions, and we're going to work with your tenant organizations to ensure that the installation has the capacity to welcome you back, but we are going to rely on your tenant commands to design their recovery plan, communicate that to us to ensure we understand the demand, and then to communicate it to you and give you the predictability of when you might be called back to work. I think that's all I have right now. I do have a couple questions, but before I get to my questions, I'm going to turn it over to Colonel Medor and let him make his first comments this morning.
All right, thanks.
You.
Hey, good morning, Team Redstone, families and friends. Great to see you again. Appreciate you joining us today. It's always a pleasure to deliver information that we have and to, of course, answer whatever questions you may have for us. So happy Thursday to everybody out there. A couple of updates and informative points I'd like to pass out to everybody there. And I've got one question already, which is a great question that I'll get to here in just a second. But as far as the state goes and how we're looking at COVID as it is today, Madison County continues to rank 9th in the state, as I put out to all of you last week. That's a better place than where we were a month ago. So congratulations to everybody out there for the great job you're doing, because we are moving the needle in the right direction and winning this battle as it is. Appreciate that. We continue to have a couple of spots in the state that are very bothersome, if you will, the counties that border the Columbus, Georgia area and Mobile County to the south. I know we're continuing to work through a lot of issues there to contain the spread going on there. So again, congrats to everybody out there. For our cases that we had for Redstone Arsenal employees, we are 85% recovered, no hospitalization. So again, awesome job there, and we're happy to hear that for our folks out there that are continuing to recover, that they're doing so and not inside of a hospital. So that's again great news. As far as another bit of great news, we received the end of last week over at Fox, our own in-house lab equipment capability, where we can test COVID-19 now in-house as opposed to sending out the lab samples. So that's a great capability. We appreciate the Army for providing us that. We do have those rates and metrics out to the commands for what that means. I will tell you the testing protocols don't change. The best thing that happens is our turnaround time is a lot quicker, 2 hours as opposed to days. And for anyone we do test, again, it will be a 2-hour turnaround for the result. And just to cover that again, since it's probably been a couple of weeks since we talked testing, there are some scenarios that I can easily discuss or codify right now that we do test that, again, haven't changed. If you are screening into Fox and you screen positive, which means based on how the answers, how you answered a few of our questions or your temperature or whatever, a clinician may feel that it's in the best interest of you that we go ahead and test you. That is one way. Another way is if you present to Fox and you are ill, that's the reason for you coming in there, you're sick, and based on that alone, and given the symptoms, again, a clinician will elect to say, hey, yes, we should probably go ahead and test you. And again, we would do that. Another avenue that we have ensured that a testing capability remains. As if during, as Colonel Smith mentioned, a positive case in one of our buildings here on the Arsenal. And by way of a contact trace battle drill, we, Fox, reach out to those individuals and determine when and how to bring you over and test you as appropriate. That has worked very well in the past, and that battle drill remains in effect. As I mentioned to you a week or two ago, I think the success that we have built here at Redstone is that we have an awesome network in place of leaders, chiefs of staff, supervisors, and senior leaders that we can affect that battle drill relatively quickly. So I think we're an A there, and we'll continue to sustain that. So again, good news is that we have now at Fox an in-house capability. Switching lanes a little bit to what Colonel Smith covered in good detail was about the governor's Safer at Home order and what that means for our beneficiaries here at Fox about the elective surgery. So with the opening up now of medical facilities, hospitals to do elective surgeries, we have a part to play in that too over at Fox. And I do have an ask for all of our beneficiaries out there who elect or pursue some surgeries, whether they be reconstructive. You know, if you've got a knee or a shoulder, you're getting booked to get in there. If you would go ahead when your surgery date is booked, regardless of which facility it's with, if you would go ahead and call over to Fox and go ahead and book your follow-up appointments, whether it's through physical therapy or just in some cases, certain surgical procedures, your surgeon will ask you to follow up with your primary care provider. I would ask that you go ahead and call over and book those appointments now as those dates get booked for you, your surgery date. That allows me to gauge need and demand that we can ensure I have the right amount of staff on hand for you. As I put out previously, we've seen, as most other medical facilities, a lot of reduced foot traffic. And I have reduced staffing in that regard. But as you begin to ramp up and pursue your medical needs, we at Fox, we do own the back end of that. So please don't hesitate to call over and go ahead and book that over with us so we can ensure we've got the right amount of people on hand for you, especially in that we know there's a codified date post-surgery that you need to get over and see somebody, and we will get that demand locked in and ensure there's staff there to meet you post-surgery. I also know that some of our surgical facilities here in the local area are going to open up on Saturdays too to start getting ahead of that backlog a little bit. So fully expecting that as those medical procedures ramp up, of course, over at Fox, we're going to see more of you over there, and we look forward to that. With that, do remember screening into the facility of both staff and patients is going to remain in effect in the foreseeable future. That COVID, unfortunately, is going to be around. It's going to be with us for some time, and the screening is one way that we at Fox can mitigate some risk not only to you but to staff and to any and every. We're going to keep that in place. Again, for a good amount of time. So just remember that as you're building in time for those appointments, especially as things start to ramp up very slow and deliberately. Ensure you, again, build that time in before coming over to Fox, because I don't want you to get jammed up for time and whatnot coming over for one of your appointments. Speaking of appointments, I had a great question here I want to jump on very quickly, which dovetails a little bit to the types of appointments I just mentioned a second ago. And the question is, when will Fox start scheduling appointments, since all the May appointments and April too, for that matter, were canceled? That's an awesome question. So I can tell you that what we won't be doing is rebooking you just because your appointment was canceled like in April. What we're doing right now, and what our providers have been doing, is looking at those based on need. We understand completely there are individuals with certain medical needs that require monthly, bi-monthly, and even every 60 appointments every 60 days, fully tracking that. And we're going to book priority by priority in that regard, because I know we have some individuals out there now that need to get in to see us. So I can tell you that's going to start when we start bringing those individuals in for those future appointments. We're going to be reaching out to those patients for the latter half of May, so we can both correlate the demand from the surgical procedures off the installation with the demands of individuals who need to get in for some of their maintenance appointments. So that is an awesome question. And you're going to hear from me again in the coming weeks as Colonel Smith and I come to you about other codified methods to ensure you know when you could start calling in yourself to book your future appointment. That's coming, I assure you. And I had a great exchange with my staff in a virtual town hall yesterday, sort of covering that a little bit of what May looks like for the Fox staff and how we could continue to make sure that we're also meeting the slow demand as it approaches us over there at Fox. So I gave you half an answer. I'll give you another half of that answer next week or the week after that as we're looking to do and ensure you are able to get locked in for that future appointment, fully tracking it. That's one of the two major areas as we look to, I say, come back to a close to normal. I don't know, it'll be a long time before we can call normal again, but close to normal is future appointments. So I fully hear you out there, and I owe you more information in that regard because we do, as Colonel Smith discussed, have to ensure we're meeting what risks are out there, and that our leaders are comfortable with the risks as we see it, and that we can ensure we're providing for your safety when we bring you in to treat you. But I assure you, for those futures appointments for individuals who have an absolute immediate need, we're reaching out to you to see when's a good time for you to come in. And again, that also goes for your surgical procedures. Since we do not have visibility on your surgical dates, if you're a beneficiary of Fox, do please call to us, and so we can book that follow-up from appointment from your surgical procedure. And that goes for physical therapy too. Again, that allows us to start understanding where the demand is, and again, that we have some staff there for you. Going through notes, making sure I've covered everything here for you. I do, and I'll probably have another question for you, and I'll be back with you in just a second. Thank you.
Sure. All right. And we've had quite a few questions come in. Sergeant Major's got one right now, and so I'm going to detail over to Sergeant Major to answer the first question we've picked up off the net.
Okay, so one of the questions that I received was, is the barbershop open? And yes, the barbershop is open, and it's open to beneficiaries that can come onto the installation. But it's primarily for military, because we have to maintain our military grooming standards, but it is open. Again, I want to remind you that if you're coming into that facility, which is the PX commissary area, you do need a cloth face covering to enter that building. Again, we've talked about the readiness of our installation, the mission accomplishments that we need to continue to look at, and safeguarding our personnel. I want to really say thank you to our medical community out there, our military police, our guard force, our fire department, and our custodians who have done an outstanding job in continuing to be on the front lines and help us combat COVID-19. Sir?
All right. Thank you, Sergeant Major. Okay, so I've got quite a few questions that came in. But first, before I get to answering them, I'm gonna reach out to all of you, and I'm noticing a lot of the questions come in are questions that we've realistically already answered. And so I ask those of you who are on the net to please help me to spread the word to your peers as you begin to have a conversation. Because what I want to make sure that I do is get to as many new questions as we can. And I want to be able to provide you some of the thought process behind the answers of those questions. But first, I'm going to cover a couple that have already been answered, but I'll get back to. Questions: will face coverings and sanitizers be available to employees? Will PPE be provided for returning employees that cannot maintain social distancing? Those questions they're great questions. But at the same time, they're questions we've answered. So the DoD policy today for Redstone Arsenal is at any point in time that you enter a DoD facility and are unable to maintain 6 feet of social distancing, we as individuals are required to put on our face a cloth face covering. We haven't issued those cloth face coverings, but we've put out the guidance on how to fashion one yourself, where ones could be picked up, and what that cloth face covering should be. From our standpoint, it should be respectable. It should cover your nose to your chin. And you should wear it when you can't maintain 6 feet of social distance or 6 feet of physical distance, anytime you're in a DoD facility. Specifically, that's your ticket to enter the commissary or the PX or any of the AFES facilities on the installation. We realize that it's much more difficult to maintain social distance there, and we realize that those that you come in contact with may be less worried about it than you are. And so, in good, true Army fashion, when in doubt, whip it out. If you're unsure of whether or not you can maintain social distance, we encourage you to put on your self-provided cloth face covering and continue to go about your business. As for PPE, there's a large discussion about PPE and who needs it and who doesn't. We're all well aware that our healthcare providers need that PPE in order to be able to provide you safe care and to preserve those healthcare individuals. We know that our firefighters, when they're responding to you, need to have that on in the case that you are positive. We know that our police officers and our guards who come in contact with you each and every day need that PPE in order to minimize the spread should they unknowingly come in contact with someone. So the provisioning of PPE is definitely based on the perceived or the known threat to the individual. I think it's probably reasonable to say that to wear a face mask and nitrile gloves while working at your computer is likely unnecessary. What we are doing is, if we can't maintain 6 feet of social distance, we are providing the appropriate PPE, at least at the Garrison. But what you will notice when you come back to work, likely, is that your tenant commands have done things to mitigate the need for PPE. They have probably, like we have at the One Stop, in the waiting room at One Stop, we have rearranged how the chairs are set so that we can ensure we have the physical distancing. In a couple of our cube farm areas, we have rearranged the cubes, or we have dedicated cubes to be emptied. We're taking into account how to keep that separation by coming up with blue, white, and red teams, where we'll bring shifts on at differing times in order to ensure we don't overcrowd our areas. Those are all things that at the Garrison we're taking into account. And I assure you that those are similar conversations that your tenant commands are all having today. How to ensure the safe social distance or physical distance of people, and at the same time, bring portions of the workforce back to work. I encourage you to communicate with your tenant commands, to understand the complexities that they're working through as they come up with their plan, and to be ready to receive that communication so that you understand the workplace that you're going to return to. There is much anxiety today about what it might look like. But I need to stress to you that the phased and conditions-based approach that we will embark on is not going to begin until no earlier than the 15th of May. Once again, we have a phased conditions-based approach that all of our tenants, as well as the Garrison, are working through today. But we know that we won't begin that plan until at the earliest, the 15th of May. Now, there are some other great questions. And I'm going to consult my text messaging here, because that's how they're getting me some of my questions. Has the Arsenal considered adding germicidal UV lamps to our HVAC units, since ventilation systems are pretty much all internal? How will the building ventilation systems get employees or service employees during normal flu season? So those are great questions, and they're ones that I've seen being discussed in the media. But I think it's important that we all go back and recognize that at this point in time, COVID-19 is not aerosol. It doesn't travel through the air as a contagion in that way. That's why you're encouraged to wear a mask, because those particles are caught up as you sneeze or as you cough, and they, as you know, drop to the ground, but they don't become aerosolized and float through the air. What we are discussing, or what we're certainly looking at as a health system, as the military, are what are the requirements that we need to put in place in order to fight COVID-19. But I assure you that while you're thinking of these, I'm going to keep track of them, and we're going to consult the CDC websites. We're going to consult the Army and determine what the best steps forward are. But I assure you that while those are good questions, those are not things that the Army or your organization will be able to put in place before we begin to bring people back. I also had a question, are there plans to install touch-free toilets and urinals and faucets in the bathrooms? That, again, would be a long-term solution. And while it's not a bad idea, those are long-term solutions that we won't be able to put in place in the near term. Those are certainly things we ought to consider, and we will consider as we look towards refurbishing and revitalizing our installation and our organizational facilities. But once again, I need to remind everyone that the best way to sanitize your hands isn't hand sanitizer. It's a good old American faucet and soap. As you'll notice in a couple of the PSAs we put out there, singing the birthday song for 20 seconds while you wash your hands is the best way that the CDC recommends to keep your hands and face clean, in addition to not touching your face. So while we use the restrooms, and that is a place where germs move back and forth between all of us, you know, we can count on each other to wash our hands with soap and water before we leave the facility, and we won't be tracking any contagion beyond that. The next question I had are there any base restrictions for retirees at the commissary or the PX? And for our retirees out there, those of you who haven't visited the commissary, I think I've seen most of you, but the commissary and the PX are absolutely open to service our beneficiaries. The restrictions we've put in place to use the commissary, the PX, or any of the AAFES facilities is simply that as you enter that facility, please put on your cloth face covering. There are limitations to the number of meat products or the number of paper products or the number of disinfectant products that you can buy at the PX. And that is to ensure that we have the ability to continue to restock those shelves so that those shopping after you have the opportunity to buy toilet paper as well. I assure you all, if we only buy what we need at the commissary and the PX, our stores will have the ability to restock, and therefore they'll be available to everyone. Please buy only what you need. The next question we have is, will desktops be phased out and replaced with laptops in order to support telework? I can speak for the Garrison, but as you all know, every organization on this installation has life cycle replacement. And there is a need for desktops as well as laptops. I believe that each organization will look at their life cycle replacement plan and come to grips and determine the number of teleworking computers their organization needs to have in the future. But I could assure you with relative certainty that at this point in time, we're not able, I know that the Garrison is not able to go buy enough laptops today to meet all of our teleworking requirements, though that is something I will consider in the future. Now, each of your tenant commands is going to deal with that problem internally, look at their demand requirement, and adjust their life cycle replacement if they deem that appropriate. The next question, will break rooms be closed? Well, I can talk to you about Redstone Arsenal as the Garrison. As the installation, we do not intend to put out a policy mandating that tenants close their break rooms. We have already modified our custodial contracts to increase the number of cleanings in those common areas and break rooms, and to ensure that those break rooms are disinfected, as well as all of the other places. Should a tenant choose to close their break rooms in order to reduce the number of personnel that'll come together at any point in time, that'll be up to the tenant commands. Here at the Garrison, we already have limited number of personnel that enter those break rooms. And should it become a social distancing problem, I will reach out to my employees and ask them to hold themselves accountable. Know that they shouldn't enter that break room if there's already a couple people in there, and to know that they need to maintain their 6 feet of social distance. If each of us can do our part and follow the rules, it won't be necessary to close a break room, because someone can go in and use the break room, and the other person can wait outside until that first person is finished, and then we can use it. If we all do our part, we can all remain safe, and at the same time have the amenities available to us to make our workday easier. Now, this is an interesting question, and it's different than the other ones that we've had before. Is there a base policy concerning helos hovering over housing areas? I'll tell you, as an aviator, I've dealt with this problem at just about every organization I've been to. And while I can tell you that the base doesn't have a specific policy about where helicopters can hover, I urge everyone here to understand that Redstone Arsenal is the home to Aviation and Missile Command and to the Redstone Test Center. And I assure you that if those aircraft are out hovering in an area, they are doing so within the applicable FAA laws that control our airspace. They're doing so in an area that is consistent with their policies and procedures to how to operate safely, and to operate safely within close proximity to populated areas. And they're doing that in order to achieve a mission that we are all here to collectively do, to bring a weapon system or a piece of equipment to the warfighter in the best condition possible. So I can tell you that the policies that exist, that our aviators abide by, are clearly delineated in the FAA pubs. The pilots are all well trained, and they are operating in approved areas that authorize the tests that we're performing. Next question. I'm going through here, and I think I have covered them all. I think I saw Sergeant Major get one delivered. Colonel Medor, did you get one delivered?
I got one. Yeah.
All right, so I'm going to defer to Colonel Medor for the time being, and we'll go over to Sergeant Major next.
All right, thank you. I had a question here about who is authorized for testing over at Fox, and a great question, specifically with contractors. So I'll cover the areas. If you are a DoD civilian, if you are an active duty service member or an active duty family member, you are authorized. If you are a TRICARE beneficiary and a contractor, the answer is yes. But outright, if you are a contractor and no ties at all as a TRICARE beneficiary, then no. You will have to work through your PCM to coordinate for the appropriate testing. Having said that, I'd like to kind of cover a little bit as we go into monitoring. We have an awesome cell that has been stood up during this time on the monitoring aspect of the installation, and this plays right in there. I would ask that if you are specifically a contractor, as we executed here in the past month, for whatever reason, if you or come into contact with someone who is positive, that you still maintain those points of contact, those communication lanes with my staff, so we can continue to maintain the site picture of the installation, because it is very important. Even though in that scenario we're not able to offer you the testing, I would ask that you'll maintain that, again, the communications with my staff. Have 3 nurses, registered nurses who are communicating a lot of things to you and you to them, of course, who they can be of great benefit to you. But appreciate that question. Thank you.
Okay. The video over to Sergeant Major, and he'll answer another question for us.
All right, thank you, sir. So we had a question that said, will all gates resume normal hours? If so, when? So I can tell you that our gates are also going to be a phased approach as we look at it, and we build back up the throughput. As it increases, we will increase our gate lanes opening, and we'll ensure that we have that throughput open for personnel to come through. Another question, is there a process to dispose of PPE? At this time, as you wear your PPE, we ask you that you throw it away in the trash. Please do not leave it if you're in the commissary in the baskets as you're leaving. It has been one of the things that have been brought up, leaving your mask or your gloves in the cart. Please throw them away. And again, as we fight this COVID-19, we need everybody's help. I want to say thank you also to the PX and commissary personnel for continuing to be that front line as well, and helping us feed our retirees and our soldiers and our beneficiaries and provide services through the PX out there as well. Sir?
Okay. All right, I had a couple more questions come in, and a couple very interesting ones as I hadn't thought about them before. So the first question is, how will vaults be cleaned like the rest of the buildings? So I will tell you that our custodians are assigned to each of the buildings, and they work with your facility managers to ensure that we get access to those places that need cleaned. As our DPW has worked with your facility managers, our custodians are hitting each and every spot. I can't confirm that we have gone in and cleaned each vault because I can't say that we've had access to it. If you've been at home and you're the one with access to the vault, I can guarantee you we haven't got there yet. But your custodians, through your coordination with your facility manager, will go in and disinfect your vaults so long as you make those available. Additionally, I had a question of whether or not the thrift store would be cleaned and disinfected. And I will tell you that of the 7.8 million square feet that has been available, or that is here on the Arsenal, that is typical workspace, we have gone in and cleaned all of those. The thrift store has the ability to coordinate with our facility managers and with our DPW, and to come in and for us to go in and clean that. I can't confirm whether it has, but I will get in contact with the thrift store as well as our facility managers to make sure that we clean that facility before we open it to the public. Another question is, will face coverings and sanitizers be available to employees? Once again, face coverings are on a DoD facility. Those are the responsibility of each of us as individuals. If we're unable to maintain our 6 feet of space, then it is our personal responsibility to ensure that we have a cloth face covering. Additionally, your tenant organizations are reviewing the requirements for PPE based on the other mitigation measures that they put in place. Again, if we're not working within 6 feet of one another, and if we don't have a specialized requirement that requires us to have touch points with customers, then the question is really, is there a requirement for PPE? And so I will caution you to work with your tenant command to determine whether or not that PPE is necessary. And if it is, I can tell you here at the Garrison, if I require you to meet directly with the public and I haven't been able to put other mitigation measures in place, as an example, at the Visitors Control Center or the CAC ID Center, we are issuing those individuals nitrile gloves and face coverings, in addition to erecting plexiglass spit shields to provide a barrier of protection between the customer and the employee, much like what you see at the commissary and the PX today. Now, that's the last question that I have. Do we have anything else, Sergeant Major? Let's see.
Is gate 1 still open?
Okay. So I will tell you, Sergeant Major's done a great job of expressing our gratitude to those folks who have been here and continue to help us support our mission essential tasks. The tenants we have on Redstone Arsenal have been doing a fantastic job of continuing, and the workforce that support them have been doing a great job continuing to deliver what the United States requires. And I appreciate everyone who has contributed to that capability. And I want to remind everyone who's at home on telework and everyone who's home on administrative leave, you are doing your part to ensure that we continue to provide a safe environment for those mission essential tasks to be done. By being at home on telework or being at home on admin leave, you are contributing to the fight. You are helping us ensure that the virus, we limit the virus's spread here on the Arsenal. Please continue to do so. As the governor announced her safer at home order, our job becomes even more important because we're not going to have people looking over our shoulder out in the community to make sure that we're doing the right thing. I ask you to make sure that you're doing the right thing. Limit your travels. Limit your interaction with individuals you don't know. And continue to monitor your personal care so that we can beat COVID-19. I remind you all that the phased return to work or the phased recovery process we have is conditions-based. It requires that all of us leaders here on the Arsenal continue to monitor the effect of the virus, not only on our workforce, but on the community, on the state, and on the nation, so that we can help make recommendations, prudent, thoughtful recommendations on when we should introduce more workforce to the Arsenal. But I assure you all that your leaders, the leaders here on Redstone Arsenal, our number one concern is the safety and the security of the workforce so that the workforce can continue to produce those mission essential, mission critical requirements for our nation. I thank each and every one of you. I ask you all to hold yourselves accountable so that we can continue to work towards recovering the Arsenal and so that all of us can help keep our community safe. Turn it over to Colonel Miller for final thoughts.
Yeah, thank you. Thank you, Kels. Just another plug-in for our community out there. When you come up to Fox, please bring your own mask. If you're coming to Fox for either an appointment or to come into the facility for whatever reason, you won't be turned away if you come out without a mask. We will put a mask on you, but we do ask that you help us preserve our PPE stocks, for what we have on hand. But do please, as you can think about it before leaving your home or wherever you're working to come over to Fox, that you bring your own mask, whether it's a cloth face covering or you've been able to procure your own N95 or any type of covering that covers your mouth and your nose. Again, just ask that you help us preserve our stocks. Again, you won't be turned away. We will mask you, but again, ask you help us to preserve our PPE on hand. We look forward to seeing you there at Fox. Come on over. It's been a pleasure to speak to some of you as you come through the drive-thru and as you come to our screening tent. Granted, things have changed a little bit, but we continue to look forward to provide you services over at Fox Army Health Center. Thank you.
Okay. And so this covers our virtual town hall for today. Again, the governor's Safer at Home order is out there to help us all protect one another. It will require each and every one of us to do the right thing. And in order to protect each other and in order to be able to recover Redstone Arsenal. I again remind you that the Redstone Arsenal Recovery Plan seeks to observe and monitor our local community and then evaluate on a conditions-based process how we will begin to phase the workforce back into Redstone Arsenal. That phased plan is based on your tenant organizations. Please, please remain patient. Please communicate with your organization. They are developing comprehensive plans to bring you all back and to keep you all safe. Communicate with your organizations as they put out their information, and know that they are communicating with us so that we can make sure we have the appropriate services in place to welcome you back to the Arsenal. But be patient, and please be open-minded and thoughtful. Everyone here is working to protect you, and then most of all, remain accountable and do what you know you need to do to protect yourself and others. Thank you all very much. Have a great week.